Hi everybody, Janine here. I am a labor and delivery nurse facilitator, which is the assistant manager when my manager's not there, so I work night shift because obviously my manager's not there at nighttime. I've been doing this for 6 years, and I'm here to answer the question today of why there's a nursing shortage. Well, in general, the nursing shortage, there's all different kinds of nursing shortages. The willing nurse shortage is the job just can't get filled, like nobody wants that job, which is a lot of like a med-surg department because a lot of people don't want to work there. There are a lot of people that do want to work there. I've worked with a lot of people that enjoy that kind of work, but a lot of people like to go into specialties or just outside the hospital kind of care. So those jobs that you'll see posted a lot are like for med-surg units because that's the need. Why is that the need? Because of the baby boomers. They're all getting older now, and they need people to take care of them. That's why if you practice, somewhere in like Florida, that's where a lot of the retirement community is going. So you're going to see a lot of med-surg jobs that are needed out there. So again, that's why one of the type of shortages. The other type of shortage is because of funding. That's like in my department is usually where we will see it. Like I work in labor and delivery. You think a lot of people want labor and delivery, but they aren't expanding the money to hire more. So therefore, we're working harder, taking on larger patient load and whatnot. That's why unions are formed, and that's why strike nursing exists, because a lot of nurses don't want to be treated that way, so they end up striking. So the other type of shortage is shortage of understanding that the nurses are needed to deliver care. So this is like in underdeveloped nations where there's a ton of sick people and just not enough nurses. They also, in other underdeveloped countries, think of a nurse, a person they don't think that needs education. So if you notice, like in other countries, doctors are educated as much as nurses are here. So actually, I know a person who works in England, actually, and he is going to be a doctor, and he was amazed when he came over here of the knowledge that nursing staff knows, because back in England, they don't, even England, like England's a highly economical country, I think, and it surprised me that they don't get training like the doctors do over here. So actually what he's ended up doing is getting married, staying out there, finishing his residency in England, and then moving over here and doing even more education to become a doctor in the States. So that's a big shortage in other countries. The other shortage is nursing education and empowerment shortage. So this is where they don't have enough people with high enough education to take care of people. So this is more of like a management role. They need. Research has associated nursing staff who have more formal education and better work environments with significantly better outcomes. So this is why they're pushing everybody to get their BSN, because they want people to know more, to critically think more. If you are a nursing student, you know that critical thinking is like the main hype of nursing school, to develop care plans, to think beyond just one patient, to think, okay, I have to prioritize, I have to know the disease process, why is this person getting sick? And overall, doing this for 6 years, in my department anyway, I've understood a lot of the disease processes. But I remember as a new nurse, it was very hard for me to think, why is this person's blood pressure high at this point of her pregnancy? Why is the baby small? What can the drugs do to babies? What can it do to the mom? Why is this safe? Why is it not safe? Why does the placenta look like this? So and you're going to notice in your practice, wherever you practice, whatever department, you're going to end up starting to know a lot. But then later on down the road, you're going to get hit with other things where you're like, oh my gosh, I've never seen this before. I still learn something new every day when I go to work, and I think I challenge you to get that same knowledge too, where you want to learn something new every day. If you're not learning something new every day, get a book, because you'll learn something. If you're still not learning something, it's time to switch careers, because you aren't a know-it-all and you need to expand your knowledge. So I am going to go for my BSN here soon. I did get my certification. I challenged you to get yours as well in whatever department you work in. A certification is saying that you're a pro in your department. So in labor and delivery, high risk OB, I consider a pro. And actually, it's gotten me jobs over people who actually have BSNs and master's degrees because they want somebody with the knowledge base. So get a certification. It's not easy, but it's worth it. I enjoy saying that I have mine, and I encourage all my employees to get it as well. So the nursing shortage, they say, is going to kind of plateau come 2020. And then I read other things that say it's going to really get worse in 2020. So I think a lot of people go into nursing without the expectations of what nursing really is. They go into it thinking, okay, cool, this is going to be a new career for me. Yeah, I like people, this will be good. Or I like seeing babies born, but then they get into the work environment and see that it's not all that it's cracked up to be sometimes. Night shift takes a really big toll on your body. A lot of people start off on nights. But usually most people figure that out when they're in nursing school, if they want to be doing nursing or not. So make sure if you're doubting it, it's probably not the career for you. And there are other careers out there that are just as good. If I wasn't a nurse, I would probably be somewhere in finance, is what I would say, or a teacher. So it's kind of neat because as a nurse, you get to be a teacher, and I'm actually an OB educator where I teach classes to the community. So it's good. You can do a lot with your career. You don't have to be in the patient care setting. So back to the nursing shortage, hopefully people do get educated and can fulfill the roles in the nursing world so that we aren't short-staffed and that the budgeting can go up so we aren't working as hard and with no breaks and stuff like that as well.